So my mom told you.
Your mom and I have been friends for a long time. How are you doing?
Still a little numb, I guess. I try not to think about it too much.
A patient gave me this the other day. Thank you, I said. Should I open it? Oh no, he said, don't open it, that's not the point. So I'm thinking, okay, thank you. I think he could tell I was a little confused. It's something you taught me about HIV, he said. Use it to teach someone else.
I eat right, I work out. I don't even drink anymore. I know my numbers. My CD4 count is in the high 400s. I'm not gonna start taking pills for the rest of my life unless I feel sick. Hey, I'm a Taurus. What can I say?
What's your doctor telling you?
Nurse practitioner? She says I should consider treatment. She gave me some good reasons.
And how are you feeling about that?
I'm adjusting, I guess.
It's a big step.
You take meds?
Now. Every day.
I was just getting used to the idea of being HIV positive, you know? Now I gotta think about it every day. That bad?
Not bad.
I didn't think I'd be starting so soon. Taking pills, I mean.
I get it. You were only diagnosed a few months ago.
Right.
There are treatment guidelines from the Department of Health and Human Services, DHHS, that are developed by a group of experts in the field. The guidelines have changed recently, so that's why I'm having this conversation with you now.
Guidelines? So it's still pretty much a guess about the best time to start?
We learn more about HIV every day. We make decisions based on the best science we have right now and the individual needs of each patient. The current meds don't cure HIV, but they can help control the virus and help keep your immune system strong. Take a look at the updated guidelines. There are people with HIV who should start treatment at any CD4 count. Pregnant women, people with HIV-associated kidney disease, people who are infected with 2 viruses, HIV and hepatitis B, and who need hepatitis B treatment, people with a history of AIDS-defining illness, like recurrent pneumonia. For others, if your CD4 count is above 500, treatment is an option. If your CD4 count is 350 or less, you should start taking HIV medication. If your CD4 count is between 350 and 500, starting HIV meds is recommended. That's you. And weighing the risks and benefits, that's what I'm recommending.
I've seen a lot of people with HIV over the years. I've seen how bad those meds can make you feel and the ways it can change your body. If I'm feeling good and I'm looking good, why would I want to do that?
My doctor told me that untreated HIV could damage or weaken my immune system. She said some studies show that starting meds at a CD4 count above 350 may lower the risk for serious illnesses, heart, liver, kidney disease, cancer.
Damn. Well, she's trying to scare you into taking your meds?
I think she was trying to be honest. It's kind of funny, in a way. What? Me giving advice to you? I was pretty much the poster child for not staying on track, especially with my meds. Back in the day, I'd start one HIV regimen, get back to my life, and stop taking my meds. My numbers went up and down. My addiction was out of control, so I just ignore my meds, sometimes for days. I developed resistance to a lot of the drugs. I burned through a lot of my options. Treatment options, work options, relationship options.
Okay.
I know you probably hear this a lot from people my age, but things are better now. If you can benefit from some of the things I went through, well, I'd really like that.
What are you thinking? When I mentioned the idea of starting treatment, what's the first thing that comes to your mind?
My life.
What do you mean?
I mean, I'm in school. And I work. I can't even remember to take a damn vitamin.
It is a commitment to yourself. I think you can do it.
I have friends. Even family that I haven't told I'm positive. Now I'm gonna be carrying pill bottles around.
We'll look at all the possible treatment options, and we'll choose the one that works best for you. It may be fewer pills than you think.
I think about the way I'm gonna look. I go online, I've read about this stuff. I know it's stupid, but I don't want to see my body change.
None of your concerns are stupid. There are risks and benefits to be weighed. Many of the medications do have side effects. You may or may not experience them. But remember, we've come a long way. With some of the newer HIV medications, side effects may be more manageable.
And I guess part of me is just like, it's not fair. I don't feel sick. I don't look sick. Why do I have to take pills for the rest of my life?
Because you have a virus. Do you know what's inside here?
No.
Maybe nothing. Maybe something good, maybe not. The outside looks fine. Pretty nice, actually. But the inside, who knows?
Okay.
With HIV, we learn more every year. We know that even though your outside might look good and you might be feeling great, untreated HIV can affect you inside and cause damage to your immune system and to your organs that may not be repaired, even if you do start treatment at some later time.
So what turned it around for you?
My kids. We all have to figure out a reason to live. They were mine. Are you afraid of taking HIV meds?
Pills make it real. Taking pills every day would just remind me of everything I need to change.
Change, yeah. I try to focus on today. I take my meds and my sobriety one day at a time.
I don't want to let my family down.
Oh, you mean your mom?
Of course. Her more than anyone.
I know your mom. And believe me, there is only one way you could ever let her down. And that is by not doing everything in your power to stay as healthy as you can for as long as you can.
I know HIV is a challenge. There's not much good about it. But it can be treated. You can take care of yourself, take your medications, and keep your appointments. For many people, it can be a manageable disease.
I know.
Starting HIV meds before your CD4 count drops too low may help preserve your CD4 cells and help you stay healthier and live longer. It may lower the possibility that you will give the virus to someone else. But with any medication, there are pros and cons. As I said, you may experience side effects. Starting the meds earlier may put you at risk for developing resistance to some drugs, or for harmful complications of medicines. There may be a greater chance of you not sticking with your treatment. And then there's the cost of long-term treatment.
I know. It's just that
I used to say, I'm sorry. When it came time to recommend treatment, I used to say, I'm sorry, it's time to start. Because it usually meant that the patient was sick or had very low CD4 cells. But now it's different. Now we can consider starting meds at a place of greater wellness, not advanced illness, to help preserve your immune system and help you stay healthier longer. I don't apologize anymore.
Sure, I want to be as healthy as I can be, but I'm not convinced yet. I don't want to be taking medicine I don't really need. I mean, someone in my situation, I don't need to be thinking about treatment. Right?
So you'll work with your nurse practitioner to figure out the best way to go.
Yes.
Ignoring this will not make it better. If you do nothing, HIV wins.
Okay.
Okay. For a long time, I had a lot of secrets. HIV was just one of them.
Yeah, that's no way to live.
Tell me something you're looking forward to in the future.
The future.
You have a future. Any wishes?
I wish I didn't have to take meds.
We all wish we could be that person who doesn't need meds. But that's not me and it's not you. Next.
I want to keep feeling good. I want to do everything that I want to do. I want to finish school, have kids. I want to be on top of my life, like that guy.
You don't know that guy. You don't know what he's got going on. Be you.